Liver disease. 20 red flags your liver is sending. Because it is one of the most important organs, you should pay attention to what it has to say about your health. Your liver performs numerous beneficial functions. According to the Institute for Quality and Efficiency in Healthcare, it's one of the body's major organs and is responsible for metabolic processes, including digesting nutrients from your diet so your body can use them and flushing out poisonous compounds before they can cause harm. Other metabolic tasks include cleaning away toxins and converting dietary nutrients. When your liver is in danger or not working right, it may try to tell you in many different ways. Here are 20 warning signs your liver may be sending you that you should watch out for. Number 1, your memory isn't as sharp as it usually is. It's one thing to lose track of where you put your vehicle keys, but if your memory has significantly declined in recent past, there may be a medical explanation for what's happening. Hepatic encephalopathy occurs when the liver is unable to efficiently eliminate toxins from the blood because the organ is failing. This can cause the toxins to accumulate in the brain, leading to the condition known as hepatic encephalopathy. Number 2, you may eat infrequently or not at all. You used to devour food as if you were competing in an eating contest, but nowadays you never feel hungry at all. What exactly is the deal? Since not being hungry is one of the most common signs that your liver isn't working well, you should be careful that you aren't feeling hungry. Number 3, you're constantly stressed out. Do you find that no matter what you do, you constantly feel exhausted? There is a possibility that liver disease is to blame for this. According to a study that was published in the Canadian Journal of Gastroenterology, one of the most extraordinarily common indicators of liver impairment is chronic fatigue. This could come as a result of alterations in neurotransmission that take place inside the brain. Number 4, you observe a yellowing of your skin or eyes. According to the Cleveland Clinic, jaundice is diagnosed when there is an abnormally high level of bilirubin in the body. Bilirubin is a yellowish pigment that is secreted by the liver. Seeing the whites of your eyes start to turn yellow or experiencing yellowing of your skin can be incredibly frightening, but it has a solid explanation. It's called jaundice, and it's because there is an abnormally high concentration of bilirubin in the body. If you do see the discoloration, it could be caused by anything from cirrhosis to hepatitis B or other liver problems. Number 5, your sleeping habits are erratic. According to a study that was published in the Egyptian Journal of Tuberculosis and Chest Diseases, it can make it especially difficult to get a good night's sleep even if you're counting sheep. While there are many things that can disrupt your normal sleep pattern, this study found that liver cirrhosis could be a possible culprit. Number 6, you've noticed your personality has changed. Changes in one's personality can be unsettling, and it's possible that people will observe these shifts in you before you even realize them yourself. In the same way that hepatic encephalopathy can cause memory loss, the accumulation of toxins in your brain can also cause a decline in mental function, causing you to behave in a manner that is inconsistent with who you normally are. Number 7, you become confused easily. The hepatic encephalopathy that results from liver failure can, unfortunately, interfere with a person's capacity to comprehend what's going on around them. Because of this, you could feel perplexed about things that wouldn't ordinarily cause you to feel confused. Number 8, struggle to concentrate. Let's face facts. Everyone has struggled at some point with their ability to focus their attention. There are moments when your brain simply refuses to cooperate. However, according to the American Liver Foundation, if you consistently feel as though you're having trouble concentrating on things, this could be your liver's way of signaling to you that it is beginning to fail. Number 9, your aches and pains are worse than normal. What could be causing all this body discomfort if you haven't been working out any harder than you normally do? Primary biliary cholangitis is one of the possible causes. This condition, in addition to creating itchy skin, can also lead to pain in the bones, muscles, or joints. Number 10. You detect stiffness in your ankles or legs. Liver illness can be brought on by a variety of factors, including excessive consumption of alcohol and obesity. A prominent warning sign of liver disease is something that most people would not anticipate, and that is swelling in the legs and ankles. If your face is puffy and you don't know why, you should make an appointment with your primary care doctor to rule out the possibility that it's a sign of something more serious. Number 11. You either have dry eyes or a dry mouth. The sensation of having dry eyes or a dry mouth can be brought on by a wide range of factors, including advancing age and the use of certain drugs. However, there is one potential cause that is far more concerning. Primary biliary cholangitis is a known source of the problem. Number 12. The color of your pee is darker than usual. One of the telltale indicators of liver damage is seeing dark pee in the toilet after using it. Not only can this be a complete surprise, but it is also one of the signs that liver damage has occurred. According to Johns Hopkins Medicine, bilirubin is not only responsible for the yellowing of the eyes or skin, but it also has the potential to change the color of your urine. Number 13. You are easily injured. As you get older, your skin naturally becomes thinner, which makes it easier for you to get bruises on your body. However, if there is really no reason why more markings are appearing on your body, it could be one of the indicators that your liver has been damaged. Liver illness is another factor that can make it a more common occurrence. Number 14. You may experience bloating. If you have experienced bloating that cannot be attributed to eating a large meal, it is possible that you are suffering from ascites, which is an accumulation of fluid in the abdominal cavity. Because abdomen swelling is one of the warning signals that liver damage is present, it is a good idea to make an appointment with your doctor just in case. Number 15. Your breast will grow bigger. If you are a man and you experience swollen breasts, this is one of the most alarming warning indicators that you may be suffering from non-alcoholic fatty liver disease. The occurrence is really perplexing, but there is a rationale behind what's going on here. Gynecomastia is the medical term for male breast tissue that is bigger than it should be. It is thought to be caused by an imbalance of estrogen and testosterone. Number 16. Your skin has an itchy rash. Itchy skin is an early sign of primary biliary cholangitis, which is described as a chronic disease that destroys the bile ducts in your liver. Primary biliary cholangitis is a disease that destroys the bile ducts in your liver, but does not typically have symptoms that are particularly noticeable. It's possible that your skin is just dry, but if it's a reoccurring problem, you should probably get it looked at. According to the Cleveland Clinic, this is especially important because itchy skin is a sign of cirrhosis of the liver. Number 17. Your hands go crimson. If we're talking about red flags, if you notice that your palms are becoming red for no apparent reason, this could be caused by a condition called non-alcoholic fatty liver disease, which is marked by an abnormal buildup of fat in the liver cells and happens in people who drink very little or no alcohol. Number 18. Your weight increases quickly. It's possible that your liver is responsible for any abrupt weight gain that seems to come out of nowhere. According to the Cleveland Clinic, this could be a symptom that you have liver cirrhosis. Liver cirrhosis is a disease that slowly develops and replaces good liver tissue with scar tissue. This prevents blood flow through the liver and prevents the organ from functioning normally. Number 19. Or perhaps you have suddenly lost weight. It's possible that one of the symptoms of liver damage is an abrupt weight gain, but it's also possible that one of the symptoms is a loss of weight. Seeing the number on the scale decrease is not only an indication of liver cirrhosis, but it is also a warning sign for hepatitis C, a highly infectious virus that causes damage to the liver. Cirrhosis of the liver is a disease in which the liver scars and swells up. Number 20. You frequently experience goosebumps. Do you suffer from persistent attack of the chills that can't be alleviated by any quantity of warm blankets? This could be a sign of cholestasis, a condition that happens when the flow of bile from the liver slows down or stops. According to experts at Johns Hopkins Medicine, cholestasis is caused by liver disease and happens when the flow of bile from the organ slows down or stops. Bottom line, liver illness can be brought on by a variety of factors, including excessive consumption of alcohol and obesity. Swelling in the legs and ankles is a prominent warning sign of liver disease. Telltale signs of liver damage include seeing dark pee in the toilet after using it. If you are experiencing any of the symptoms mentioned in this video, then please consult immediately with your healthcare professional. For more health tips, please subscribe to Our Daily Health.